And the alternate care facility at State Fair Park is playing a new role in the fight against COVID-19. Governor Tony Evers announced today part of that facility will now offer outpatient coronavirus infusion treatment. Katie Crowther has details on who might benefit from this.
The new infusion treatment will be offered here at State Fair Park's alternate care facility starting Tuesday. An emergency room doctor says the treatment is very similar to the infusion President Donald Trump received when he battled coronavirus.
It's made by a different manufacturer, but it's the same type of science that he had used.
It's called bamlanivimab, or BAM-BAM for short. Dr. Brad Burmeister, a member of the Wisconsin Medical Society's COVID-19 task force and frontline worker for Bellin Health in Green Bay, says having this treatment available at a location separate from hospitals and doctors' offices is a really great step.
There's more people who are candidates out there who, for whatever reason, aren't receiving it. So having more access to it, like the State Fair Park, is a great way to increase the likelihood that people can receive this.
Wisconsin hospitals first received some shipments of BAM-BAM around Thanksgiving. Dr. Burmeister says it's a one-time IV treatment that takes about an hour. Anyone who receives it is monitored after for any adverse reactions. The best candidates are people who've had close exposure to someone with COVID-19 and are starting to show symptoms, or are just starting to experience respiratory symptoms after already testing positive, especially those with underlying medical conditions.
This is really designed for people who we would anticipate, although they don't need to be hospitalized right now, that in the course of their disease, as it progresses with coronavirus, that they're at high risk for needing hospitalization and getting really sick from it.
BAM-BAM is not for people already hospitalized with COVID-19 or experiencing severe breathing issues. Dr. Burmeister says clinical trials show people who were treated with it were at least 5 times less likely to require hospitalization. The key is early intervention.
We like to give it to them as soon as we can after they are first diagnosed with COVID-19.